And it's the reason why I chose to call my presentation "Time is Gold," because it's very easy to help and to diagnose breast cancer early. The first step is breast self-exams. That is what I would like to tell you today, like the main message here. Please do it. This goes for both men and women, but of course, women, as they're more affected, this is more to you. So try to do it in the once a month at least, in the second or third day after your period, because that's the point where the hormones are the lowest in your body. Always try to do it either in the shower, in your bed while you're lying down, or both places. Why is this? Because in the shower, usually with water and soap, it is easier to actually examine, like putting your fingers and letting them go through your skin. It's easier. And why when you're lying on your bed? Because it is different if you're standing up, because the breast tissue tends to go down. So it will be a little bit more difficult, but if you're laying down, it will all go backwards and it will let you actually feel a little bit more. So that's my recommendation. Do it with 4 fingers, this 4 fingers you're seeing here. Go up and down, go in circles, go from the nipple around, always taking, going and palpating your armpit, because that's one place we have a lot of troubles with. First, because most women examine their breasts but not the armpit, so they have certain abnormalities there they're not going to be able to figure out on time. And also the mammograms, they do not catch that part very well, so it would be very helpful if you could do it. Also, when you go to the doctor, we usually do an exam, and we try to check the armpit also. As I was telling you before, check the color, check the skin, and check the nipple. When there's malignant tissue and there's cancer in the breast, it usually starts retracting all the tissue. So the nipple might actually either start producing like liquid, like similar to milk, or it might actually go inwards. So if you suddenly, that's normal for certain women, but if you, from one day to another, you saw that happened, especially if it's only to one of your breasts, that's something you should actually go to the doctor to be checked. And of course, the mammogram. There's a little, not controversy, but a little disagreement between the American Cancer Society about when the mammograms should be done. But I would say after age 45, it should be done at least a year. The disagreement is if it should be after 50 or 45, and if it should be done every year or every 2 years. Since it's not harming anyone now, or at least the benefit is better than the problem it might causes, I would still think that it's worth doing it every year after age 45. That might change in the future, but at least that's the recommendations today, so you should do it. It's a little bit uncomfortable, I'm not going to say it's not, but I think it's worth it. It's just probably half an hour of discomfort or even less, and it's a whole year of peace of mind. So please do it. Actually, the American Cancer Society has a program, and it can be free. If you go to community health centers, probably you're going to be able to find people who can tell you more about the program. So please go ahead and do it.